Disordered eating messaging is all around us. You can hardly leave your house or check your phone without seeing something about dieting, weight loss, or exercise. With all that pressure, it can be hard to recognize habits have become harmful or even an eating disorder. If you're concerned you or a loved one might have an eating disorder, I want to introduce you to Equip. Equip is a fully virtual, evidence-based eating disorder treatment program that helps patients achieve lasting recovery at home. Every Equip patient is matched with a multidisciplinary care team that includes a therapist, dietitian, medical provider, and mentors. And you get a personalized treatment plan that's tailored to your unique goals and challenges. Equip treats patients of all ages and all eating disorder diagnoses. It's covered by insurance, and there's no wait list. If you think that you or a loved one could be struggling with an eating disorder, don't wait to get help. Visit equip.health to learn more. That's equip.health.
Business is booming, but you know what really helped? Xero, the accounting platform for small businesses. I used to think spreadsheets were just part of it. Ugh. But real-time cash flow? Wow. Invoices that chase themselves? Even better. Books that automate? That's a big one. And I can keep track from my phone while I get the job done. No spreadsheet in sight. What a life. Do right by yourself and your business and search Xero for your free trial. Conditions apply.
Welcome back to the Oral Health Podcast. Now, you've been learning a lot about the history of all the bathroom essentials this week. So we're going to talk about something that not everyone might use every day, but certainly if you play sports or, I think that's the only reason you might use this is when you're playing sport. But we're going to talk about mouth guards. Karen, is there any other use apart from playing a contact sport that someone would need a mouth guard? Because they're different to the ones that you wear at night to we're not talking about those, like for grinding.
No, they're thicker. These are thicker. These are for protection. So to protect your not only your teeth, but your jaw joint, so that you have less chance of damaging other parts of your face, obviously knocking out teeth, chipping them, breaking them, that kind of thing. So normally contact sports, but they are similar to the ones that you might wear if you grind your teeth at night, or even if you're having your teeth whitened. Those are obviously significantly thinner. These are quite a good bulk of, if you've ever seen anybody with them, they're kind of like quite.
Yes. Yeah.
I'm doing the action, but you can't see me.
As well as obviously coming at it, you're going to come out from a dental side. I, several years and concussions ago, used to play a lot of contact sport, and we had to have very specific special mouth guards to protect them. So I know a little bit from the sporty side. So I'm going to be able to contribute a little bit more than normal today, Karen. I'm looking forward to it, because normally I just look really silly, and you have all the. Now it's going to be a bit more split. Thank you.
Oh, good. Yeah. Take the weight off. Yeah, they are very important for a lot of different things that you might not even think of. I know that you used to roller derby, and I would have said you wear one for that, because the potential of falling is relatively high. We kind of say contact sports, so rugby is an obvious one. Football, I would say yes. Martial arts. Anything where you are going to likely to bump into somebody
or something,
or something.
With roller derby especially, you're falling at a speed, but onto a very hard surface, whereas obviously grass and things is a bit more pillowy, not by much, but a little bit. But as well, I'd say things like tennis.
There are a lot of different things that I would like to see people wearing mouth guards for. Basketball. Basketball is very contact. They do run into each other. I think in some ways it can be sort of a trend. We're used, like I say, we're used to seeing rugby players wearing them, but I less so basketball players, baseball players maybe, but I think there's less sort of seeing those kind of sports people wearing them, and it takes somebody famous to start doing it, and hopefully the rest of them will do it. Obviously some schools wouldn't let you take part in the sport if you don't have one. I mean, and we're talking about the proper ones. We're
Yes.
not talking about the heat and bite on
Yeah, the
ones
boil
that
and
you get from
bites.
sports shops.
Yeah, I mean, they're just basically rubbery plastic that you heat up, bite
Mm,
onto it, and then keep until it molds. But there's so much room for like
also.
user error, and
Yeah,
it's
and they can
less
actually
ideal.
be counterproductive because they are actually dangerous because they don't stay in the mouth. They can be a choking hazard. So, and they're not protecting the teeth enough because they're not custom made.
Yeah,
So when you go to the dentist, you will have a personal impression taken of your mouth, and then that is then made to fit your mouth and your mouth alone. Um, it's great now. Some of them have, the names put in because we know what kids are like.
yep,
Um, you can have them in lots of different colours. You can have them in your sports team colour, which
yeah, you
is
can.
which is great.
When we were
Um,
playing, we had that was part of the regulations that you could only have it in white. You couldn't have red, you couldn't have black because in the event that you do get hurt, they need to see instantly, like, is there blood? So if it's a dark color or it's red, that's a lot harder to do. So it was like you gotta have white or now. But I don't think other sports are as like
no, I
strict
mean
on
my son competes in Taekwondo,
that.
and he has a white one, but I think that's just to go with his
His outfit.
suit.
I used to
He's
like
not
having
got
a
a
black
suit
one
either.
until they got strict because it makes it look like you've got no teeth and you look a bit more scary. And don't really look that intimidating, so I needed
To
all the
be
help
to be
I could
fair, you don't need a black mouth guard to look intimidating, Sophie.
get. Please, you think so? But no, I mean, this is an area that is very interesting when you look at the history of them because they've come a really long way. I mean, the first mouth guards ever were made in the 1890s, from what we can see, of like this latex rubbery type of material from a gutta percha tree.
Yeah,
And it was like a hardened sap that people used as gum shields. And if you look at old pictures, which I'm sure we'll find some, they're very primitive, but they did the job. And when they started being used in professional sports, it became really controversial. Like the first boxer to use them in the 20s, they always said like was cheating because he had an unfair advantage. He had this thing that was protecting his face, and they thought it was unfair for him to have that. Now,
totally.
obviously, very much.
Well, I might go a little bit dental geek on you now, but gutta percha is still used
Is it
in,
really?
yes, in root canal treatments. It seals the root canals after they've been cleaned out. So
Oh,
that's
wow.
just serving the dental geeks out there, because I know
Nice.
that there's at least one or two of us
Oh, of
around.
course. It's our bread and
There you
butter,
go.
Karen.
You've learned something. It's a
Yeah,
nice orange
definitely.
colour as well. So yeah, it wouldn't suit your team with the white, but yeah, I can see how it is because it is a flexible sort of rubbery material. Obviously, way before latex and all of the modern things were invented, but
Mhm.
that is quite a, somebody's thought about that. I mean, it probably a dentist that saw too many boxes with teeth hanging out and broken jaws,
Yeah,
possibly. But
possibly, yeah.
yeah, I
And
mean,
then,
it's not a let's just do it. It should be compulsory, I think,
mhm.
in a lot of sports.
Yeah,
Not an optional was the word I was looking for, and I couldn't find.
yeah. No, when we get towards more like the 40s and the 50s, we're starting to see things like acrylic and resin being used, and that means that they can be much more custom fitted, more comfortable to wear because you can easily mold it over the upper and the lower teeth. So it wasn't really bulky and cumbersome in athletes' mouths or whoever was needing to wear it. Um, Really, really important. And then when we get towards the 50s, they are started to be recognized, at least by the American Dental Association, from what I can read. They recommended the use of mouth guards in contact sports from the 60s onwards. And
Yeah,
that regulation obviously still in place, which is ideal, and what
yeah,
we would always recommend as well.
totally. Yeah, I mean, you don't see anybody, doing, boxers always. It's the first thing they spit out, isn't it? The,
Yeah,
the
absolutely.
mouth guard. But yeah, I think it should be spread to more sports. I mean, to be honest, anywhere you might fall over, which could be in the street, really.
Oh, if you're me,
Rather than
absolutely
walking
around
around
the
with
house. I
a
chipped off my tooth on a coffee cup, Karen. I need them.
I don't think you'd be able to drink your coffee with a mouth guard in, so
No, not a proper one. Not a proper one, no. The American Dental Association now recommends mouth guards for 29 different contact sports, and also all their high school football players have to wear
Mm,
a mouth guard. You see it obviously in American films. It's kind of like attached to
yeah,
their helmet.
yeah.
But yeah, we never really see it in sports other than rugby. That's the main thing that I've seen it in, especially watching on TV, watching like,
Yeah, I mean, most martial artists do wear it.
yeah.
I mean, mixed martial arts and those kind of things, they too tend to wear it. As I say, with my son doing taekwondo, I see him with
Mhm.
one. But I think show jumpers, people riding horses should wear them as well because being
Yeah,
a rider myself, you of times your face planted is too many to
scary.
number
Yeah.
really. So yeah, it's a
Mhm.
dangerous old world out there, isn't it?
It
Really?
is, it is, and I don't want to give the impression that anyone needs to wander around in cotton wool, But if you're taking part in a sport where you could regularly get your head kicked in, let's look after your jawbone and your teeth, because
Yeah,
some
yeah.
don't
I
gone.
mean, like you say, you could get hit with a tennis racket if you're playing doubles. Somebody could smack you in the face, and I think we're not saying that this is going to happen every time you play, but
Hmm.
it's that one time that you might not have it that you need it. I mean, we certainly had a patient who was a professional cyclist and had come off the bike
Hmm.
and knocked four front teeth out. And
Yeah.
that's another one that would you actually say we think you should wear a mouth guard?
Mhm.
Possibly.
Maybe, yeah. I do wonder, where does the line come in when we go from mouth guard good to, is this a choking hazard? I'm just thinking, like, with cycling, could it then easily get dislodged? And that's one of the
They're
reasons
not easy to
we,
dislodge.
yeah,
If you've worn one from a dentist, they take some getting out
yeah.
because they are made to fit your mouth, and you kind of have to get your finger behind and kind of get
Hmm.
the suction break on it. But they don't float around your mouth if you've got a proper one.
Yeah.
We have rugby clubs that employ a dentist to go to the club one Saturday and just do impression after impression to make sure all the kids, all the grown-ups, everybody who's going to be playing rugby has a mouth guard made. And
Hmm.
it's an easy procedure. It's not like it's painful or anything like that. It's just a quick impression, and it's all made for you. I think you've got to remember to put it in your mouth though. So
Yeah, just a bit. But
I mean,
that's,
the trick is have it named, have it in a pot with your name on it, but don't just stick it in your kit bag after everything. You need to get it out and you need to clean it.
oh yeah, for the love of God, clean it, because they go so disgusting. Like, think about how much is in your mouth, and if you forget to clean it, you go to your next session, you go to put it in again,
Yeah,
you'll never feel more ill. Honest to God,
and
like
I don't,
everyone's done it.
I don't
Everyone's
want to
done it.
make a sweeping statement, but I imagine boys are more likely to just do that than
Quite
girls.
possibly.
You just need to take it out. You can, with most of them, I mean, check with your dentist first, but for most of them, you can put them in the effervescent, the fizzy tablets that you would clean a retainer in.
Yeah.
And just a quick brush with your toothbrush. I wouldn't use toothpaste on it. I would just brush anything sort of loose under some running water and then just bung it in to freshen it up to be soaked. Leave it to air dry and then put it back in the pot again.
Yeah, absolutely.
And don't use hot water because it'll warp it.
It will warp it, especially if you are just using a cheap boil and bite mouth guard, which I really don't recommend either as
No, not at all.
from
No.
our side as the Oral Health Foundation, but also as someone that has played sport with these things. Like, you do end up just being able to pop it out with your tongue, and you
No,
find if
not
it's
good
loose
enough.
fitting, you just kind of like fiddling
It's
with
not
it.
good enough. Unfortunately, one of the downsides, certainly with children, is their mouth changes because
Yeah.
obviously they're losing teeth. So they probably need to have the mouth guard checked sort of once a year, really, just to make sure it's well fitting.
Hmm.
Also, if you've got an orthodontic appliance fitted, you might need to have another one made
Yeah.
to make sure the space for the brace work in there. But with adults, they will last a couple of years, 2-3 years. But anytime you see signs of wear or any splitting or anything like that, it's time for a new one because you've lost that protection.
Yeah. Same with a helmet. If you see a crack in the helmet, it needs to be replaced. Same with a mouth guard.
Absolutely. Yeah,
Um,
it's
yeah.
part of your equipment. If you think, you put your boots on, you put your gloves on, you put whatever on, put your kit on, your mouth guard's part of your kit.
Hmm. Yeah, absolutely. And mouth guards, actually, there's some really promising things that are coming out technology-wise that give us a little bit of a glimpse as to where they're going to go in the future. I mean, we are now seeing much more advanced concussion protocol in sports where there is contact and sensors actually inside some mouth guards so that if they do get a clock, it will alert the concussion team to get checked. And
Impressive.
they are really, really
Oh
dangerous.
yeah.
Anything to
Yeah, yeah.
detect them,
Hmm.
fabulous. Yeah.
Yeah. I think you have to be aware of the signs of concussion, and they can mimic a lot of other things.
Yeah.
And you do have to be wary of that.
Well, you want to figure it out quickly as well because it is
Yeah.
dangerous.
Yeah.
And yeah, there's so many interesting ways that mouth guards can help prevent problems with
Yeah.
your health. Obviously, there's the obvious, but also as this technology gets cheaper, we might even see stuff like this in like low level games, where
Yeah. Yeah.
it's not for the
Dungeons
ultra
and
pro
Dragons.
players anymore. Oh, come on now. I don't mean like that. I mean like
I know how rough you
high
lot
school
get.
hockey or like,
Oh, hockey should definitely use them.
yeah.
Definitely. Not even down the line. They should be wearing them now.
Hmm.
It's not going to stop the accident happening, but it will help to prevent the damage that could be so much worse.
Yeah.
So you might have a split lip, but you could have lost a tooth as well.
Yeah.
So it's not preventing the accident happening, because the only way you can do that is sit in your house and lock all the doors.
Well, exactly. Yeah.
Well, actually, no, most
And,
accidents
be
happen in the
careful when you're
home,
doing
don't
sports
they?
and yeah.
So
But
maybe you're not safe in your own house. I don't know where you can be safe.
where else do you think it would be good to see things like mouth guards go as technology develops and we learn more as a
Yeah,
dent?
I mean, I like the idea of it actually picking up whereabouts the blow has been,
Mm,
just so that you can, check strains on the jaw. And like you say, I mean, an upward hit is something that would then, it can throw the neck backwards as well. So, you could be looking at various parts of the head and the neck that might have got damaging. I
mm.
mean, we are getting to the stage now where we're doing less and less impressions, because we're just scanning the teeth and making the mouth guard from that, and lots of other prosthetic devices as well, which is great for anybody who has a really strong gag reflex.
Or just
um
has sensory issues because those
yeah,
are
it's a
not
bit.
nice.
I mean, I've just got over my gag reflex, and I have to say there is a technique, and it really, really works. So I'm it is possible to get beyond it, but with scanning, obviously you don't need that in the first place. You still do have to tolerate the mouth guard, though.
Yeah,
It might be
absolutely.
just pushing the problem down the road a little bit, but because the palate isn't covered, most people can wear the mouth guard because it's only covering their teeth,
Yeah.
not
It took a bit of
interfering
getting
with their
used to, but
tongue.
you've got it once you've got it.
Yeah, and I mean, talking is a be no good for us too, would it?
No.
Yeah, talking is a bit of an issue with it. So maybe I should do that. When I've had enough of you, I'd just say, Sophie, go and put your mouth guard in.
You know what? On that note, I'm going to end this session today. Goodness me. Right, I hope that you've learned something. Any sports players out there, go clean your mouth guards, because chances are you might have forgotten. Remember to put them back in. And yeah, take care of your teeth while you're exercising. It'll only benefit you.
Business is booming. But you know what really helped? Xero, the accounting platform for small businesses. I used to think unpaid bills were just part of it. Ugh. But batch payments? Wow. Automated accounts payable? Even better. All in one place. That's a big one. And I can keep track from my phone while I get the job done. No bills in sight. What a life. Do right by yourself and your business and search Xero for your free trial. Conditions apply.
Quick question. When was the last time a display ad changed your mind? Now think about the last time a friend told you about something they loved. Different feeling, right? That's how podcast advertising works. A host who's built real trust with their audience talks about your brand in their own words, in their own voice. It doesn't interrupt the experience. It's part of it. With Acast, you can access the world's largest podcast marketplace. Choose the right shows, the right audiences, the right format. Then watch the data tell you it worked. You're not buying impressions. You're buying influence. Learn more by visiting acast.com/advertise.